Hi, everybody. This is Dr. Kelley here, and I am back with Know My Voice. There was a little hiatus there for a bit, and so I think we'll start fresh with a new season, a new approach and focus. Um, and usually, the topics I talk about are things that I see or happen or I'm noticing in um, the current events and looking into the future. But this one in particular, the title of this episode is going to be this that is a training issue. And what sparked my interest in first writing about this, so it's also a blog on Nightingale Apps' Know My Voice, was something I read a couple of weeks ago in a technology blog about a solution being it's a training issue. And so just for a little bit of background, for those that may not know, my name is Tiffany Kelley. I am board certified informaticist, PhD prepared in the specialty, and over 20 years working in healthcare information technology and over a decade focused on innovation. And the technology side of things in development in healthcare is incredibly complicated. Anybody that's been on the side of development or even using the technology knows it is not an easy thing to do. And if it feels easy, it means that there's been a lot of effort. If it feels easy on the user, that means there's been a lot of attention paid to the user experience. And that's something I'm going to touch upon today. So that is a training issue. What happens in technology development, especially for healthcare professionals, and I can only speak to the user group being healthcare professionals, and but some of these principles may apply to other industries as well in those design sessions, so depending upon how specific you're able to get in designing new technology, there's always this effort to balance out um, what the users need, whether that's in a content perspective or a workflow perspective or reporting perspective. And there's probably more, but those are the three that come to mind. So, right, content is one thing, like what do you need to be able to enter and or retrieve? How you do that is a whole other part of the process. And then how it gets displayed and or utilized is also another part of the process. But as you can imagine, going through a design process, first you need to figure out what do you need to be able to put into the system? What do you need to add? And then how does it get utilized by the different groups of users? So for those that maybe aren't in healthcare, there's a variety of different roles. Obviously, the most commonly known ones are nurses, doctors, uh, assistants, pharmacists, physical therapists, occupational therapists. I'm not intentionally leaving anybody out. There's so many more, right? And so, with the knowledge that there's so many roles involved, people need access to something as simple as a temperature or a blood pressure for different reasons, right? You're not necessarily going to go do physical therapy on a patient that's having dizziness this morning. That is probably going to be something you're going to wait on. You don't want them to fall to the ground. Whereas the nurse may need to know if they might be dehydrated or if the medication might be too high, and then report that back to the physician who may change the order for pharmacy, right? So there's a many layers to a simple data point. Where things get interesting is in trying to figure out how to get that data in a way that the functionality of the system supports it. And so this is where I like to call it the art and the science come together because this is where you're designing and coming up with creative solutions sometimes. Um, but on occasion, when it does start to feel a little bit more complicated than one would like, you will often hear somebody say, well, then that's going to be a training issue. I do not love hearing that statement because what that means is the training issue becomes something that needs to be put onto the user by way of an educational, whether it's in person, online, short form, long form, seminar that now becomes the responsibility of the individual rather than striving to make it intuitive to the user. And so hopefully you can see the differences there, right? And so let me give you a couple of examples. And this first example is outside of healthcare, and it's something everybody probably experiences every day. I know I experience it far more than I would like. So let's say you're scrolling on your phone and you're getting those targeted ads for something that may be of interest to you. And so you may catch something may catch your eye and you click on it, the shop now or whatever it may be. And then up comes this pop-up, join our for updates now and you'll receive your welcome discount of 10 or 15% off with code such and such. But you need to be able to enter your email and maybe even your phone number. And sometimes it's just like not something you want to do, right? So instinctively, your mind is thinking, I just want to see that thing that I wanted to learn more about. Now you have to get out of that box. And so your eyes are scanning for the X to get out of the box. And I've noticed that this X is becoming much harder to find now than it was in the past. It's very faint, it's often not clearly delineated, and it means that the longer you wait to find it, you're more likely to either just back out of the website yourself or put your email in just to get to the next stop. So this lack of visibility of the X is really a user experience or usability design issue. And, one could say that's a training issue that you have to train everybody to look really carefully to find that X. But is that necessary, right? This becomes the user's issue rather than the system design issue that could remove this extra step. Would this page get less emails probably if they made it more visible? That's something that would need some data to find out. But I do know that there's likely an intention to make it a little bit harder so that people will stick around and put their email in. It's not necessarily best for the person that's just trying to look at the item, but it does provide an opportunity to connect with that particular user either today or in the future with that particular business. But this training issue is where we are shifting the responsibility of the design from that of the creative development to that of the person. And this becomes trickier in healthcare because now you're putting it on, there's thousands of employees that work in any single healthcare organization. Increases the risk for something to go awry. But in healthcare, healthcare not just today, not just 10 years ago, but really is dependent upon clinical and administrative information systems to manage individual and population level care. Even when I first started out as a nurse, over 2 decades ago, while I wasn't using a clinical information system, I know our unit clerk was to manage orders, and there were lab, pharmacy, and radiology systems that were active. There wasn't necessarily a front end for nursing documentation, but there were clinical and administrative information systems that were in progress. And now we are moving towards as much digital as possible. But most clinicians, and I'm using that word specifically because while I know the curriculum for nursing, this likely expands beyond just nursing. Most clinicians are not formally educated on the foundations of informatics and or information system design. There, for one, there's really not enough time in the degree granting program to have the number of courses you would need to feel like you have that complete, comprehensive understanding. This often lends itself to master's degrees or post baccalaureate or postgraduate certificate programs, maybe PhDs for those that go through that. So, with that in mind, there's going to be this inherent concern and maybe even intimidation faced by a clinical user on the technology. Where am I doing it right? And so that thought of I don't want to if it's not documented, it's not done. That's a very commonly heard and or felt phrase, at least in nursing. And when you're not sure where exactly you need to chart or how you need to chart, then it becomes much more stressful because you might just begin overcharting or unintentionally omitting something. Um, so some clinicians will overchart, others are going to struggle to know what exactly needs to be charted, and they may unintentionally miss something. The extremes here are a result of this. If it's not documented, it's not done. But when it becomes hard to know where to go next or how to enter some data correctly, you can see the risk, right? So someone may, I gave this example many years ago when I was teaching and first really introducing informatics and its linked to electronic health records. Um, and one of the examples I gave was allergies. And so for those that are working within systems, there may be an allergy that a patient has that's not documented yet. And there may be an interest to want to give all of the possible information about this allergy. Let's say they're allergic to, um, they have a lactose allergy, or focus on a medication. Perhaps there's a penicillin allergy, either one, right? Food or drug allergy. And you may want to share what happens or what brings it on. Putting a free text allergy in is not going to trigger the drug or drug food allergy interaction checking rules engine that's behind the system. But you would not know that if it was not explicitly shared with you. And then so you could see how somebody would unintentionally lead for potential error. And so this is, for anyone that's hearing this for the first time, every allergy needs to be entered in a structured data format to allow for that rules engine to check. There may be a comment field you can get more specific, but that first pass needs to have that structured data element. If it's free text, it won't catch it, at least not as of, 2026, perhaps in the future when we get more advanced. But that's just one example. So adding something like that to this baseline of, it's a training issue. Now you're adding multiple different extra things for somebody to have to remember. And of course, there's going to be some aspects of training that need to occur. You need to know how to function with the system. What is it? The Nursing Informatics Scope and Standards of Practice has computer and information literacy as an expectation for every nurse, not just informatics nurses, but that everybody should be able to function with a computer and know how to manage information. Where it gets more specific is if you have got an advanced degree in informatics. So think about how many times, let's now think about your own watch or smartwatch, smart device, smartphone, whatever it is. Like, how many times have you turned to watch a video or training session to use any of those things? Like, how many times have you gone to YouTube or the company's site to figure out how to do something like that? And I can speak for myself that it's rare, right? I will search when I get stuck. And I will typically just maneuver my way around for the functions that I need. Now, there's probably more that I could use, but I'm not at a place where I need to adapt to those just yet. That will evolve. So for me, to be able to pick up a device and use it, even though the first couple hours may be a little tough, once everything's set up, I'm good, right? And that's what we should be striving for. We should be striving for this type of user experience with healthcare technology. The need for formal training sessions, getting started, sure, should be there, minimal but brief. But as you're adding on more things, the design of the systems should be such that the user is able to follow what the next step is through an intuitive human-computer interaction experience. Now, there's an abundance of qualitative and quantitative data to show nurses, doctors, healthcare professionals, we're all working against the clock each day. So what do I mean by that? Working against the clock? The best way I can think to describe that is just from my own experience when I was in bedside care. I would get to, my shift would start at 7, whether it was morning or night. But the time doesn't really matter, as does that feeling of already being behind. Right. So the second you're there, you already feel behind, and it's a rush. It's a rush to be like, okay, let me get report as fast as I can and as thorough as I can, because I need to be able to get to the med room to check the meds to figure out who needs meds by 8 a.m., right? And sometimes you're not out of report until 8 a.m. because of needing to talk to multiple different nurses, or somebody's more complicated than someone else. And so this sense of needing to race against the clock occurs throughout the entire shift. There's not a lot of extra time to sit down and figure out how to learn a new piece of functionality, or a new um, thing that's supposed to be helpful, but instead is taking away your time. So there's just never enough minutes to go around for everything that needs to get done. I can't think of a time where I would leave my shift and feel like I was able to go and do everything I had wanted to do above and beyond what was expected. And of course, that set a high bar for myself, but that's not a great feeling as you're, striving to do the best possible care you can, knowing that there were other places where your time got that didn't need to happen that way. So adding more things to what is expected of any of these healthcare professionals is only going to increase the burden rather than create relief. And we need to switch that around. So healthcare technology cannot be delivered without the use, healthcare today cannot be delivered without the use of technology. And that has been true for a very long time. The stethoscope is a technology. We don't often think of it that way, but we would not be able to give standardized care without the use of that and understand somebody's heart, lung, and bowel sounds. And that's a very simple skill that we learn very early in our training for any healthcare professional role. So what we must consider is that we have a workforce that's already spread thin, and instead of more training issues, why not create a sense of ease and strive for that aspect and intuitive flow for an experience each day. That's my, you know, that would be just to feel, even talking about it, how that would relieve so much pressure on the sense of those that are working in healthcare, um, to be able to not just chart, but in a way that it's feeling as though it's integrated with the day. So those are my thoughts for today on this is a training issue. My goal is to come back each week with a new episode, and I will see you soon. Take care. Have a great day.